Today, we're going to be reviewing how to set up a quick pick in DENTRIX Ascend. My name is Kirsten. I've been a registered dental hygienist, and I'm going to show you today how to set up a quick pick inside DENTRIX Ascend into your clinical note templates. And today, the topic's going to be about periodontal classification. So let's begin. When you go into the settings, you go into the patient care. You go into clinical note template. As you go into the clinical note template, you want to scroll down into the hygiene or periodontics. In this case, I'm going to place it into hygiene. We're going to go into the adult dental hygiene visit right over here in the clinical note template. And in the first video to the left toolbar, and in the first video, in this instance, we're going to choose adult dental hygiene visit. And in this first video, we had already discussed how we set up the clinical note setup. And to manage setup, go to Manage Quick Picks. Click on Quick Picks. And then again, you're going to get a Quick Picks, Manage Quick Picks list. So you want to scroll down and look for periodontal classification. Now, this is based on the AAP guidelines. I'm going to put that into the YouTube notes for you, so you have that as reference to any dentist or office that you work in. So when we scroll down here, we want to click on periodontal classification. Okay, here it gives you the whole kit and caboodle. I'm going to actually create a new, right? This gives you every single with the classifications and staging. And so what I'm going to do is I'm going to do create new. I'm going to create a quick pick name. I'm going to say periodontal classifications. And I kind of blended a little bit with the classifications and grading. And it's really just a time saver, but so long as you have class 1, class 2, class 3, or class 4 in your note, you know exactly how to proceed with treatment planning. So again, you have to have a quick pick question to prompt the check boxes. So what you want to do is go, what is the client's periodontal classification? It's exactly how it is in the clinical template notes for patients. I say clients. Next, have checkbox. Next. Now you get an ultimate. So it goes first, give it a name, which we did. Then we select the type, checkboxes or note. Then we specify the options. So the options here is the first one is going to be class, perio classification 1. And that is gingival disease, plaque induced. And then I usually get the prompt of 1 to 2 millimeters for those who might not be familiar with the periodontal classifications. The second one will be periodontal class 2. And this is chronic periodontal periodontitis, localized slight. This is your 3 to 4 millimeters. Okay. Now this one is periodontal class 3, aggressive, perio localized, mod to severe with greater than 5 or greater than millimeters. Then you add a fifth one. This one's periodontal class 4, and this is aggressive periodontal with tooth loss. And this is greater than 5 millimeters. So there's usually in that classification 4, there's usually a tooth loss 1 or 2. Okay. So then I'm going to click done, and that saves this new periodontal classification. So if you click here, go into classification, now we can insert this into periodontal classification. So if we scroll up here, we can manage quick picks, go over into the manage quick picks area, scroll down. To periodontal classification. Which is right here. And then insert and close. As you notice here, there's all sorts of different quick picks here. So we're going to go into that. I'm going to show you multiple times how to use and manage a quick pick. Some of them are preset. I usually keep it pretty simple with this, 1, 2, 3, or 4 with a simple little, you could always change this up if you want to edit it. Just go down to edit, but insert and close. Okay. So now you have the periodontal classification. Now, this is a note here already preset in your clinical note setup for your ADHV, and the polished hand scaled followed with ultrasonic. I always put hand scaled in there and polish first because I want a clean area of biofilm. Everybody's a little bit different. So again, you can go into the clinical note template setup, type this to your needs. The benefits of inserting clinical note templates or manage quick picks is that these manage quick picks can be used in any clinical note template that you set up. So it saves you a lot of time. And it also keeps it consistent with the assessment of what the periodontal classification. So you know how much time to schedule. If you're doing a 4341, which is a quadrant therapy, or a 4342, which is a localized scaling and root planning therapy. So I'm going to do another quick pick. So we're going to go into Plaque. Again, we're going to go into manage quick picks. We're going to scroll down, manage quick picks, and we're going to go into Plaque. So there was a quick pick for Plaque. Okay. So here is perio Plaque. You can skip it. Or you can do none, light, moderate, and heavy. But I decided to create a Plaque new quick pick. I think I already did it unless I did not save it. Nope, I did not save it. So let's do that. This happens. Don't forget to insert and close. I've done that a couple times. So we want to create a new. We want to enter Plaque. Okay. And we want to enter what was the level of plaque in the patient's mouth. Okay, then go next. Okay, I do check boxes again. You enter none. You can add another response, light with cervical localized. Add another, light with cervical and interprox. Add another, moderate with localized interprox. Moderate with cervical and interprox. So the reason why I use cervical is right along the gum line means it's a toothbrushing, or maybe it's around a crown. They need a rubber tip stimulator or a soft pick, and interprox means probably a soft pick or floss. And then of course, heavy is usually your once a day toothbrushers. Okay. So you get a couple of different, and then there's also, so I'm going to say done. That's going to put that in there. And what was the level? So insert and close. So now we have plaque done. Okay. And at the end, I'm going to show you all of this. So this is calculus. So calculus, as you know, is different than the plaque. So we're going to go again. So I'm going to do a couple of these. Manage quick picks. Okay, go in here. Go into calculus. Doesn't look like they have one here. Maybe they call it tartar. I don't know, but I'm going to check both. Nope, they don't. So I'm going to create a new, and I'm going to put calculus. And what is the level of calculus? Next, do checkbox again. Next, none. Light, lower lingual anteriors. Light. Okay. So you can edit these clinical quick picks any way you want to. As you know, I'm kind of upper right, upper left, buccal, and lower anteriors. You know, sometimes we get that in the parotid glands. So I'm just kind of doing more detail there. But the check boxes you can do multiple if you want, right? So you want to say insert and close, and there your calculus comes. Okay. Now we're going to do bleeding. So these are quick check boxes, so it frees you up some time. Okay. Bleeding, we're going to go manage quick picks. We're going to go into, I think it's going to come down here. Perio bleeding, I think I saw. There we go. Perio bleeding has skipped none, moderate, right? I'm going to create a new for gingival bleeding. Okay, check boxes again. It's going to say none. Yay, they're healthy. Light, moderate, heavy. Okay, now I can go into more detail here, but with bleeding, if it's light, moderate, or heavy, you kind of give a description. You can always add notes in there if you're doing that. Okay, done. Okay, insert and close. Okay, and the staining, there was one in here, so we're going to go into manage quick pick. I think I saw one up here. There we go. Create new. There's some that are already in here. Okay. Great. Then we have the other with the stain the patient has, so insert and close. So last but not least, we're going to talk about recommended oral hygiene. Now, there's some oral hygiene instructions that you can actually type in here. And so we can go manage quick picks. Down here, there's oral hygiene. Let's see, habits. Thought I saw it in here, but maybe it's only in the perio. Hold on one second. Scroll down here. So let's create a new one. Quick pick name, oral hygiene, or I should say current oral hygiene routine. Okay. Okay, check boxes. Next, manual toothbrush 2 times per day. Electric toothbrush. Two times per day. I usually put Oral-B or Sonicare. Flossing 1 time per day. 2 times per day. Flossing 1 time per day. Soft picking 1 time per day. Water pick 1 time. Actually, I'm going to put rubber tip stimulator. I still believe in these. These are great around crown margins. Hopefully they're not underneath the gum line. And then water pick 1 time per day. Okay, so these are just kind of, a simple list that you could do. You can add another response if they're using a medicament, MI paste, 1 to 2 times per day as a prevention. Okay. And that's basically it. And then, and sometimes if someone's using like an over-the-counter mouth rinse, you just have to write it in. Okay, now, the interesting thing about quick picks like this, you can create multiple quick picks where you can do multiple quick picks in it. So for example, I'm going to say done. So now these are the options, but insert. So you have to always press insert and close. So that gets inserted in there. Okay. Now you have current oral hygiene habits, but here there's also a current oral hygiene habit. So this is kind of recommended. So I'm going to click that here. So now we're going to go into manage quick picks and go into recommended oral hygiene habits. Not in there. So I'm going to create new. Okay. Okay, that's pretty much it. So basically what I typed in there is electric toothbrush 2 to 3 times a day with the 2-minute cycle. The manual toothbrush 2 to 3 times a day. I'm going to say for 3 minutes. That's the latest. Floss 1 time a day, floss and soft pick 1 time a day, rubber tip stimulator 1 time a day around crown margins, and water pick 1 to 2 times a day. So then you want to click done, and you can insert and close, and that will go into your recommended oral hygiene routine. So make sure that your cursor here is ready to go. So you want to say manage quick picks, you want to go in, or you can go cancel, go recommended with insert. Okay, and there you have it. Okay, so here with the dentist exam too, you work with the dentist how they want that, but the classifications are 1, 2, and 3. Carries risk assessment, low, moderate, or high. Then you can also add signatures. So we want to do manage quick pick, and we want to create new into RDH name, and we can do who is RDH professional providing care. And then you can do checkboxes. You can do enter a response, Debbie, Jamie, temp for RDH. And you know, as if you're a temporary RDH, you have to put your license in there too. So done. Okay. Let's say I want to edit this because we want to have their licensors here, licensing here. So next, checkbox. So we go in and we edit. So that way we know it's a dental hygienist. Okay. Okay. And insert and close. You could do the same thing for the RDHs, and then the next appointment, next recare appointment, next, I should say, DDS appointment, manage quick picks, create new, restorative RDH. It's going to say, what is the okay. So I did tooth number. If there's a tooth that needs to be restored, Invisalign, occlusal guard, or exam and FMX. Okay. And then for the next dental hygiene recare, we could do the same. So we want to go into manage quick picks, create new, and just say next recare appointment with RDH. What is the current RDH recare? What is the current ADH fee or periodontal maintenance visit recare sequence? Next, checkboxes, enter 6 months or 1110, add another 4 months, 1110 or 4910. And I put these in here mainly so it prompts the front office, and 3 months is the 4910. Okay. So that's kind of how we do it. Or you can add another response, which is upper right, lower right, scaling and root planing, which is your 4341, upper left, lower left, scaling, root planing, which is your 4342, or you can add localized scaling, root planing, which is your 4342, and then scaling, root planing for quads with medicaments. And then add another laser. Okay, so these are some of your options. Okay, so I'm going to click done. And now you have easy, kind of an easy where you can do multiple insert and close. Now I'll show you how this all works now. So we did intraoral photos down here in periodontal classification. If you don't insert it, you have to have the cursor. If you don't insert it into the note, it actually goes down all the way to here. Okay, so notice how long that took us, right? We did quick picks for quite a while here, but once you get it set up, these quick picks, the benefits of that, you can reuse these cheap complaints and recare radiographs and intraoral photos. All of these can be reused in any note sequence that the hygienist has. So now we'll save. Okay. And this is your demonstration video. I know it's a little bit longer for periodontal classification, managing your quick picks that we did, your periodontal classification, plaque index, calculus, bleeding, and stain. And then the current oral hygiene habits that the client has and the recommended daily routine that you can go in and edit, the clinical dental exam, occlusion classifications, and caries risk assessment, which you as a hygienist will know. And that is basically it. So thank you for joining us here in learning how to write a clinical note template setup with quick picks. Have a great day.